Presentation, I'll be talking about the West African Ebola virus epidemic that plagued the West African region from 2013 to 2016. However, has been a constant pestilence of the West African region for roughly 50 years now. Lesson overview for this presentation is to find out the causes or potential causes of the Ebola virus, the overall effects and toll it has had on not just West Africa, but the entire world globally, and how its effects have varied among different socioeconomic classes and the biological, physical, and social environment and climate surrounding the disease. Um, I also want to discover, number one, the etiology of this disease and to understand its final effects among various social and biological classifications. So the Ebola virus of West Africa um, started in 2013 and ran through 2016. It had been discovered before that, somewhere around about 1917. The Ebola virus was discovered as a 1976, I'm sorry, the Ebola virus was discovered as a potential threat to humans, and the first human case was discovered then. Its origins were somewhat unknown and is still speculated today. Um, but initially, the virus was more so reserved to other countries, other than the countries that were actually initially uh, subjugated to the virus in 2013. Um, West African countries, there are several uh, boundaries today were eventually affected in less prominent proportions. So it was typically singled out to one specific country instead of multiple countries at one time, which is what made this Ebola epidemic particularly special and unique. There were significant casualties throughout the course of this epidemic. So once again, typically the Ebola virus ran in one country. It had a few fatalities, casualties, and then it would run its course into maybe another region or country from there. Never before had it been this widespread. There were significant casualties, but its effects were severely felt in countries like specifically Guinea, which is the first country that it was spotted in during this epidemic, Liberia, and Sierra Leone. Nevertheless, cases were reported in countries as far as Europe and even the United States, and I actually recall this. There was extensive emergency response from the World Health Organization and the CDC to try to control and contain the virus and limit the spread and contact, specifically through international travel restrictions. Um, Such an epidemic would likely not have been so able to spread to such different parts of the world were it not due to, of course, the influx of international travel. The Ebola virus of West Africa infected nearly 30,000 people total, and that includes not just the West African regions, but the United States as a whole, which there were very few cases, Europe, and all countries that were affected in West Africa and Central Africa, but mainly West Africa, with Guinea, Sierra Leone, and Liberia being the three primary countries affected. Of the 30,000 who were infected, roughly 11,000 were unfortunately passed away from the virus, making the mortality rate somewhere around about 39 to 40%. Um, the West African region, of course, was plagued and infected the most. So that leaves about a 60% survival rate overall for this specific episode of the epidemic. Of course, this has fluctuated as we've seen this virus fluctuate from region to region and flare up from region to region and from country to country. But for this particular epidemic, the survival rate was significantly more than what it likely would have been in past years. So the environmental and social climate. So what are some of the main drivers of this disease. That's what we're trying to find out. What has continued to be its etiology, and how have we managed to tame its widespread effect? So we know that West Africa is often plagued. Many countries in the region of West Africa are often plagued with extreme poverty. Many countries in West Africa are highly affected and fail to coordinate a cohesive governmental role in healthcare. Um, we know that there's a lot of uh, environmental corruption, economic corruption that plagues governments in Africa. Wealth is certainly not distributed equally. And people are battling for resources, people are battling for healthcare, people are battling for wealth, and basic needs, essentials, and even sanitation conditions, living conditions are subpar in practically breeding grounds for any disease, yet alone what's common to the West African region, which is often Ebola. Significantly poor attention to potential outbreaks and disease are specifically a very major cause of many of the outbreaks that we are seeing, even today, of Ebola, and not just Ebola, but other viruses as well. The United States, the CDC, again, and WHO, the World Health Organization, have stepped in significantly, and the United States has even donated several dollars to efforts in surveillance of these viruses and monitoring these viruses, and trying to contain and control the spread of these viruses, and proactive health care for people who are living in many of these regions. So the environmental social climate, the Ebola virus is no new concept. So we've known about the Ebola virus since at least 1976, when the first human contact was discovered. Um, of course, it was first spotted in Guinea for this particular section of outbreak. But the primary reason why we saw such a major uptick in influx in this virus spinning off during the 2013 to 2016 period was because of a lack of, once again, cohesive healthcare efforts, specifically from a local standpoint in the region. There was very few proactive measures that were taken to try to prevent a future epidemic that obviously we knew had the strong potential of coming to this region. Ever since 1976, there have been over 24 outbreaks, just simply not as large as the 2013 to 2016 outbreak that we witnessed. So it has been something that we've known about for years and years, and there's once again just not a lot of cohesion around actually settling the matter, and trying to prevent the spread and prevent the outbreak of this disease in the future, which is why many Western countries have stepped in to intervene. Um, Overall, the mortality rate for all cases cited in the Central and West African region, this is not just reserved to 2013 to 2016, but from the periods from 1976 up until modern times, we saw a 66% mortality rate. So unfortunately, it is um, causing more expirations than not. So where was Ebola and why? So again, Guinea, Sierra Leone, and Liberia were the primary countries where we saw the Ebola virus spin off. Prior to the outbreak that spun over a decade ago, there has been roughly 24 other outbreaks since 1976, on the year of its discovery. Ebola virus to be derived from fruit. Transmission from person to person can cause can be caused by any direct contact with bodily fluids. It is not airborne, so All other documented outbreaks were limited to one single country, as I stated earlier, but the 2013 to 2016 outbreak affected multiple countries across the West African region and even spread into Europe and the United States. Obviously, it was contained in the United States and Europe. There was, once again, travel restrictions, travel bans, and many interventions that contained the spread. But there in West Africa, it captured over 30,000 people and unfortunately resulted in over 11,000 expirations. Um, so once again, significant interventions and recommendations from the CDC and the World Health Organization, including the declaration of a state of emergency, which was declared in 2013 and 2014. I'm sorry, and was ended in 2016. And as well as contact tracing and mass isolation were all methods that helped to curb the virus. So from an etiology standpoint, we know that Ebola is spun off from direct contact with infected humans or primates' bodily fluids. We also know that West Africa was particularly plagued due to harsh living conditions that are common among West African communities: poor sanitation, malnutrition, and overall extreme poverty. So there's a lot of factors at play here. While it is difficult to pinpoint the first case of transmission, we fully understand the likelihood of transmission and the plausible factors that could have created a breeding, or plausible factors that could have created a breeding ground for transmission. There is even a clear hypothesis that Ebola was more prominent in West Africa because of the region's close proximity to zoonotic reservoirs of Ebola. So it was very clear that the location and proximity of these regions and countries were breeding grounds for this type of virus. Social economics were not the only factors at play here, and we see the inverse of this, where in Sierra Leone, families from wealthier classes reported higher cases of infection. So it's not as straightforward as just saying that there were poor communities that were infected at higher rates. In fact, in certain regions, um, families from higher income classes were infected at higher rates, whereas in certain regions, of course, the inverse occurred where families from lower income and social economic statuses were infected at higher rates. Um, the significance of cross-contamination is obviously clear here. Just like, for instance, with urban areas reported higher numbers than rural areas, which is somewhat a match with what we are seeing with the wealthier communities and wealthier families having a higher infection rate, because of course the wealthier families and communities were often in urban areas. So once again, this is highlighting the significance of cross-contamination, just like how there was a minimum spread into the United States and Europe. We see where cross-contamination and widespread transmission from travel, from region to region, and even from country to country, and potentially even from continent to continent, could cause an increase in the spread. So where does Ebola stand today? Is there anything we should be worried about? Is there an issue that's potentially imminent? Today, there are significantly less reported cases of Ebola than there were 9 to 12 years ago, obviously, and most of all cases are reserved to one country. Right now, we are seeing a major uptick in Ebola cases, particularly in the Democratic Republic of Congo, the DRC. As of today, actually, on the day that this presentation was created, there were 57 cases of Ebola, and of these cases, there have been 35 deaths in the Democratic Republic of Congo alone. These are mainly reserved and contained to specific hotspots, which are shown on the map here. The year before 2025, we saw cases spike in Rwanda, and the year before that, we saw cases uptick in Uganda. So today, the CDC continues to monitor these countries as well as other countries. It's very unpredictable where another outbreak can be. We do know that once again, it's being contained mainly in West Africa and Central Africa. And it seems to be a country by year case basis where we're seeing these major spikes in particular countries year over year, and they're often reserved to one country. So there are monitoring efforts spun off from the CDC, including disease surveillance and infection control. And these are all efforts to contain the cases and to support the communities that otherwise would not have much support in the way of healthcare and any type of regulations. At the current moment, the Ebola virus does not pose a major threat to the United States, so that's very nice to know. Um, right now, there are obviously measures in place to ensure that United States citizens are not being infected either by, individuals from some of these hotspots and countries coming over into the United States or vice versa, United States citizens visiting over there. And that is the end of the presentation. It was very interesting to study this topic. As someone who does remember the Ebola outbreak of 2013 to 2016 specifically, and how West African countries were affected and how it even threatened the United States at one point. It has been interesting to see how the CDC and the World Health Organization has coordinated efforts around containing the spread and ensuring that the countries in West Africa get the support that they need to create a more sanitary environment, a more immune environment to this virus. And so it will be interesting to see how cases evolve specifically in 2025 as we see this uptick in cases in the Democratic Republic of Congo. Thank you.